Strong muscles are needed to carry out most of our daily activities. You can imagine that someone who maybe has weak quad muscles in their legs might have difficulty walking upstairs or walking to the grocery store. Now, loss of muscle strength is common as people get older, and it's often associated with functional limitations and disability. Now, the good news is that performing resistant exercises can improve muscle strength and improve our function and our ability to do activities. In this video, I'll review how muscle strength impacts our function and how exercise can improve our strength and our function. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Because different terms will come up during this video, I wanted to briefly review them. So physical limitation often refers to someone who has difficulty with mobility, things like difficulty walking a quarter of a mile or walking upstairs. And a physical limitation will often precede a physical disability. Now, a physical disability often refers to a more severe problem like difficulty performing basic activities of daily living, such as dressing or bathing on their own. Older men and women exhibit a threefold greater loss in muscle strength compared to a loss in muscle mass. Now, this doesn't undermine the importance of muscle mass, but it does underscore the importance of the quality of muscle as this is demonstrated in strength. In part 2 of this series, I will go over muscle mass. To what degree is muscle weakness associated with functional problems and disability? And there was a study of about 1,500 women, average age 80 years old, and they broke them into 4 groups, from those who were the strongest to those who were the weakest. They found that the weakest group were about 6 times more likely to have some sort of functional limitation compared to the strongest group. Additionally, the weakest group was about 25 times more likely to have some sort of difficulty getting up from a chair, and about 12 times more likely to walk slow or have some difficulty walking compared to the stronger group. Another study looked at the association of muscle weakness to difficulty with stairs, and they found that in men, the weakest group had a 4-fold increased odds of having some difficulty with stairs, and in women, the weakest group had about a 3-fold increased difficulty with using stairs. Now, moving beyond a physical limitation, what about a real disability? And so here there was a study of about 1,600 men, and they found that those who had significant weakness in their quad muscles were 2 times more likely to suffer some disability in a basic activity of daily living, such as dressing or bathing. So how can we address it? So as you guessed, exercise, and specifically resistant training, as you can imagine with weights, will improve someone's strength. Well, what kind of gains can we expect an older person to make by doing resistant training? And so there was a meta-analysis of over 1,000 older people, and they found that through resistant training, people who are older can improve their leg press by 30%, their chest press by 25%, knee extension by about 33%, and lat pull down also by about 20 to 25%. So this is great. Older people can get stronger with exercise, but does that translate into improved function and also reducing the risk of some sort of limitation? So there was a study of over 6,000 older people, and by putting them through an exercise program, they were able to show that yes, doing resistant training can decrease the risk of having a functional limitation or disability. To get a bit more granular, there was a study that looked at 100 people, average age 85, and they broke them up into a group, those who were doing resistant training program that was a high intensity versus those people who were not doing exercise. And what they found was that gait speed, how quickly someone walked, increased by 12% in the exercise group versus a 1% decline in the sedentary group. Stair climbing power increased 28% in the exercise group versus 4% in the sedentary group. And then there was another study of older adults between the ages of 65 and 79, and they were able to demonstrate that resistant training programs significantly reduced the time needed to rise successfully from a chair by almost 30%. Strength training has also been shown to help improve people who already have a physical disability. And there was a study of about 215 people who had a physical disability. These are basic activities of daily living like dressing. And they found that the group that was put into a resistance training program 3 times a week for about 25 minutes each session, and they did this for 6 months, and they found that there was about a 15 to 18% reduced disability rate in those people who were doing the strength training. Are there specific factors of a resistance training program that are important to get the most benefit? And so studies show that doing high intensity, meaning doing more weight, is more beneficial than doing low weight. For example, there was a study of older adults, average age of 70 years, and those people randomized to a light intensity program and a high intensity. Light intensity was where they were lifting about 50% of what they could maximally lift, versus high intensity was they were lifting about 80% of what they could maximally lift. And what they found was that the high intensity group, they had greater gains. So for lower body strength, it improved by 63% versus only 43% in the light group. For upper body strength, improved by 90% in the high intensity group versus only 66% in the low intensity group. What happens if someone stops exercising? Will they start losing their strength? And the answer is yes. And it happens relatively quickly and to a significant degree. So there was a study looking at subjects with an average age of about 70 years. And they found that after 4 months of detraining, meaning they stopped doing their strength training, their strength declined by 25% after 4 months. After 8 months, it declined by 46%. And after 12 months, it declined by 62%. This demonstrates the importance of maintaining a resistance exercise program. And I would recommend maybe on a calendar at home, you circle off 2 or 3 times a week to help maintain this habit of keeping up these exercises. Let's wrap up this video and go over a few key points. Number 1, muscle weakness is an important risk factor for developing a functional limitation or physical disability. Number 2, resistance training program can improve muscle strength and functional ability. Number 3, maintaining the resistance training program is very important because if you stop over the course of a few months, you will lose a dramatic amount of strength. And number 4, ideally, the resistance training program should include high intensity exercise. If you found this video helpful, please click the like button below and subscribe. Thank you for watching my video. I look forward to seeing you in my next video or in my office.